It's my feel-good breakfast show.
Welcome back to what is officially a Health Tuesday on your Feel Good Breakfast Show. Thank you so much for rejoining the conversation. This morning, we are focusing on prostate cancer. It affects millions of men around the world. Those 6 degrees become 3 degrees, I think, when it comes to prostate cancer. And joining us this morning is urologist Dr. Samkele Salukuzana, who is here to break down the stigma around getting tested. It's so easy, and to help us better understand that prevention is, and testing is better than cure. Doc, thank you so much for being here. Do you feel like you need to suck in a deep breath of air when you start this conversation, or do you feel quite buoyed by the fact that we're sitting here talking about this? This is quite a big thing. So many men need to hear this, but so few men are acting on it. How do you feel going into this conversation?
Yeah, I'm actually quite excited talking about this. Essentially talk about this every day. You know, I do talks in the communities, and I talk about this on a daily basis. That's my work.
And you do it well, thank you.
Yes, and that's why we brought you on, because we know we do need assistance, because I think that sometimes we, as men, we struggle to talk about these things amongst each other, actually. We wait for a doctor, we wait for a professional, but we don't talk to each other about it. And I think that's why we are here today. So when it comes to prostate cancer, let's start there. You know, what is prostate cancer? Take us through layman's terms, what is happening?
Thanks a lot for the question. Prostate cancer basically is getting cancer in the male, gland, which basically sits between the bladder and the urethra. So it's basically essentially an abnormal growth of cells and dysregulation by the body for different reasons, which I'll allude to a bit later. It's essentially just abnormal growth of cells in the prostate gland.
This speaks to a very wide pool that we are drawing from here. Who is most at risk of prostate cancer? I suppose age flashes in my head. I see the big number 40 in bright lights there. But is age the only pre-indicator, or who's most at risk?
All right, thanks for the question. So patients that are at risk, or individuals at risk of getting prostate cancer, is obviously elderly males. We're talking about age. From the age of 40 and going beyond.
You're not elderly at 40, though, just so you...
No.
You're still okay.
I heard elderly now. I got worried. I'm heading that way. Oops.
Yeah. So your risk increases over the age of 40.
Okay.
And the other factors that you know of is basically having first-degree relatives who've had prostate cancer. If you've had your father at a younger age, and if you've got a sister or a mother who's had breast cancer, you're at increased risk. The biggest thing we're talking about is race. Black men are at increased risk of getting prostate cancer as opposed to non-black males. And they've got about a 60% chance of getting prostate cancer, and twice as likely to die from prostate cancer as opposed to their white counterparts.
That is incredible. That is terrifying.
It is. And now let's talk about, testing and actually getting a screening early. I think that for us, when we have conversation about prostate cancer testing, we always have this thing in our head about the doctor putting on the glove and saying, like, let's go to the basement. And let's talk about it. I think we need to. So the testing, number one, why is it so important? And number two, should we really be afraid of testing?
Yeah, no, thanks a lot for that question again. So, screening for prostate cancer is a very important thing. And like you said, mentioning testing. And no one should be afraid of testing for prostate cancer. And you're quite right, most men are afraid of getting a finger through their back.
Yes.
But, the guidelines from the Prostate Cancer Foundation advocate, in men who are asymptomatic, to rather have a PSA test, which is a very simple test. Get just blood drawn, and, the day after you could get results. And, obviously, in patients who are also symptomatic, who've got low urinary tract symptoms, in the form of difficulties in passing urine, or irritative symptoms, or any other things like seeing blood in urine, at any age, if you see such things, you should get tested.
For sure.
But over the age of 40, the simplest thing we do is just a PSA test. We don't really always need to do a rectal examination, asymptomatic men, which is what usually scares men away.
Yeah, and even if that was the case, just go and do it, because we know that an early detection makes a massive difference. Why? Why is it so important to get the test done, to get the early detection, so you can treat this before it becomes more than that? Why is this so important?
Yeah, so it's very important because, there's great evidence to suggest that, if you detect prostate cancer early, you are likely to survive and live longer from being treated at an early stage versus someone who presents at a later stage, which is something we still see. And that's why the Prostate Cancer Foundation is pushing the notion forward of ensuring that patients get screened and tested early. Because if you've got localized prostate cancer diagnosed early, you are going to have a 98%
You can manage that,
Manage it quite easily, and 98% survival rate over 5 years. You know, over 98% of men will be alive after 5 years if they, you know, they're treated early, as opposed to someone who's diagnosed late, who has about 30% survival at 5 years.
Wow.
It's such an important thing because there's lots of options in treating in localized prostate cancer.
And underpinning the work that you do every day. Once again, thank you so much for being that person. Yeah.
Naturally, with cancers, you know, it can also be hereditary. So beyond the fact that there would be symptoms, they just say if there's blood in your urine, discomfort, you know, while passing urine, and a bunch of different other symptoms, if it's in your family, would you recommend that men go for this PSA test? And sort of give me an age. I mean, if you know that your dad had prostate cancer, or, you know, what do we do? Do we say, hey, I'm 30 years old, I am a bit nervous, I need to go and get tested as soon as possible? Like, what do you recommend in that situation?
Yeah, I think just to stress again, the other one important thing is that prostate cancer localized, which is it is often asymptomatic. So you can't wait for symptoms. That just need to bring that out. And to answer your question, as mentioned earlier, in patients who are at risk, like I said, family member, not only your father, you know, or your brother having prostate cancer, but also if you've got a family of anyone who's got breast cancer. So we recommend screening at the age of 40. You know, anything below that, you're unlikely to get a good yield from screening much iller. You know, we do see patients at 30 wanting to get tested, and you're unlikely to get much from that from the age of 40 and upwards. And obviously, in the white counterparts, you talk about 45, you know, in non-blacks, because the risk is a bit lower than the black Africans.
Would love to delve a little deeper into why that is from a medical and from a socio-economic standpoint, what the African story looks like, because I think it's slightly different here. The one bottom line is men need to get tested. If you're 40 years old, you got to go get tested. That's the bottom line. And I think if we can just preach that from the pulpits, we can do this. But we're going to continue this discussion. A lot of questions. And if you have any more yourself, please drop us them on our social media platforms right now. Let's spread this conversation as wide as we can.
It's my feel-good breakfast show.
It is your Feel Good Breakfast Show, Expresso at S3, and we continue our conversation on bringing awareness about prostate cancer. And earlier, urologist Dr. Sam spoke about the importance of regular screenings from a certain age and diagnosis. We are now going to discuss forms of treatment and encouraging research and initiatives, as well as developments within this particular field. So let's continue. Dr. Sam, we just changed your name today. Is that okay, Dr. Sam? Does it work? Okay, fantastic.
Because you're our doc now. You know, we claim you, eh? We claim you as our own. This is amazing to me that we are having such a simple conversation. This feels like such a simple dynamic that is so difficult for us to do normally. Great, we've got the setting for it now. We've got the focus. Why are men so resistant? You've chosen to make this pretty much your life path, calling, to drive this down our silly male brains. Why is it so difficult for men to have this conversation, do you think?
Yeah, I think, you know, generally men often don't seek for healthcare.
In general,
Yes, in general. I mean, there are other reasons for that, you know, depending on where you come from. You know, these traditional other social reasons. And obviously, and with prostate cancer, the sensitivity of, you know, the male reproductive organs and one getting a rectal examination. So men are often quite resistant to do that, and, you know, because of the fear of that, and again, some social and cultural backgrounds, you know, in the African populations.
And when it literally could be life-saving. It could be the relationship with your wife, with your children, represented in that one action, you know?
So now let's look at treatments for prostate cancer. You know, we've gone into our screening. The doctor comes back, the results are positive, we have prostate cancer. That feeling, of course, very, very tough on anybody getting that diagnosis. However, there are treatments available. So can you discuss some of the treatments? And then more importantly, the type of mind space that we should be in the event that we do have that diagnosis?
Yeah, no, thanks for that. So, you know, prostate cancer is mentioned, you know, you can get localized, early diagnosed prostate cancer and advanced, which is called metastatic, or when cancer spread beyond that. So when you're talking of localized cancer, which is diagnosed early, there's several forms of treatment. You know, amongst the other treatment options, we have active surveillance or active monitoring, where you diagnose a prostate cancer, but we don't actually need to treat you now. We can actually observe you by doing regular PSAs, and we can decide when to actually start treating you. Then the other options then would include surgical removal of the prostate, which could be done in any form, could be done as an open procedure, or it could be done robotically these days. And the other forms then would include radiation in the form of external beam radiation, or it could be in the form of brachytherapy.
Yeah.
I'm sure people have heard of like seeds instilled into your prostate. And the other form is watchful waiting, you know, an elderly guy who's got prostate cancer, but we're thinking they are unlikely to die from their cancer, they're likely to die from other causes.
Yeah.
We don't actively treat those patients, you know. Once they start getting symptoms of advanced disease, then we start treating them. And in terms of advanced prostate cancer, metastatic, where cancer's gone beyond the
Yes.
gland, so we're dealing more with a palliative situation, but there's several drugs that we can use to, you know, prolong life even in that situation. And often counsel patients, like, even if you've got metastatic prostate cancer, you can still live long with the options we have. You know, the most important one is hormonal therapy, where we remove testosterone, the hormone, from the body to try and prevent the progression or slow down the progression of cancer, which could be done surgically or medically.
Yeah.
Does the testosterone drive it? Because it seems like quite an interesting dynamic where you've got older men whose testosterone levels are waning.
Yeah.
How then does that inform the growth of the cancer?
Yeah, so that's a very interesting and very controversial topic. It has been in our field that, you know, there's been thoughts and beliefs, like you're saying, that testosterone does drive you to get prostate cancer, but younger men who've got high testosterone don't have cancer, but older men who basically have low testosterone, you know,
Are
actually
at
have prostate
higher
cancer,
prevalence,
you know.
okay.
So, look, there's been lots of studies done, you know, earlier looking at doing androgen deprivation therapy in the form of removing testosterone, and there's been very good evidence suggests that it does prevent the growth, and, you know, we're way beyond that. We're getting other drugs now that are more advanced in treating patients, you know, hormonally. And the other thing with testosterone is that the other reason why they get prostate cancer when they're older, when your testosterone goes down, there's dysregulation in the growth of cells, and that's why the guys actually get cancer.
That's
But-
where the,
yeah, that's where the
a
problem
side
is.
door is open.
Yes, but you know for sure that there's great evidence that if you do hormonal therapy, patients live longer.
Okay, wow.
This is fascinating. And regular screening has been quite a narrative between, you know, us in this conversation. So are there alternative tests? I know you said PSA, rectal exam. Are there any other tests for regular screening?
Yeah, look, that's a very interesting question and also quite controversial, and I don't think it has reached the guidelines yet.
Okay.
So, you know, there's other forms where one can talk of doing imaging in the form of an MRI.
Yeah.
You know, it's a quite a costly exercise, about 12,000 rands to do an MRI. And again, the evidence is not yet there to suggest that we can screen men with an MRI.
That's
You know, it's a
definitive,
very- it's a
okay.
very, So PSA is a mainstay, you know, and rectal examination, you know, depending.
What I love about this, though, it feels like this is a hotbed of activity. It feels like there's a lot of focus, a lot of mental, collective focus on this challenge, a lot of positive numbers coming out now. I think the data can be terrifying sometimes. I know you get to see some pretty scary numbers. And for us, what it's telling me is that we know more, that we've got more data to work off, which is amazing. We now need more men to get tested. If you're 40 years old, go and do it. There are ways that you can get tested that aren't as invasive as a rectal exam now. The PSA, very different approach. If you're over 40, you have a responsibility to yourself, to your family, to get yourself tested. I'm going to do it.